Hello everyone, I am Dr. Ramesh Kumar, specialist obstetrician and gynecologist working at NMC Medical Center, Shahba, Sharjah. My areas of expertise include antenatal care, high-risk pregnancy, infertility, contraceptive management and the menopausal treatment. Today we will be discussing about the cervical cancer. It is the second most commonest cancer in women between 35 to 5 years of age, and it is easily detectable, and if detected early it is completely curable. HPV infection or the human papilloma virus infection is the common causative factor for the cervical cancer, and it is spread by sexual contact more than 90% of the cases, and there are more than 100 types of HPV virus, and they are categorized into two types. The one is high risk and the low risk, and the high risk, most of the time these are high risk viruses cause or the reason for the cervical cancer, and the second one is the low risk, is the one which causes genital warts in both women and men. The risk factors of cervical cancer are an early age at sexual intercourse, like less than 17 or 18 years, and when there is history of smoking and multiple sex partners, and there is when the patient is using oral contraceptive pills more than 5 years. These all contribute to development of cervical cancer. The symptoms of cervical cancer are any abnormal vaginal bleeding, like bleeding after the intercourse, or any heavy or prolonged menstrual bleeding, or bleeding after the menopause. These are the abnormal vaginal bleeding. These could be the symptoms of cervical cancer. And the second thing is any foul smelling vaginal discharge, which could be frothy or blood stained and profuse and foul smelling. And the third thing is a pelvic pain and any pain during intercourse. We can reduce the risk of cervical cancer by practicing safe sex, like using condoms, or sex with a single partner, and then going for regular screening tests for cervical cancer. And the fourth one is HPV vaccination. There is vaccination for this human papilloma virus infection. There are two kinds of tests which are done for screening of cervical cancer. One is a pap smear or a pap test, what is called as pap smear or a pap test, and the second thing is an HPV testing, HPV DNA testing, and the third thing is a combined testing where you combine both pap smear as well as an HPV testing. These are the screening tests for the cervical cancer. Cervical cancer screening is recommended between 25 to 65 years of age. Between 25 to 30 years of age, usually the pap test is done once in 3 years. From 30 and above, it is usually the pap test with HPV testing, that is the combined test, which is done once in 5 years up to 65 years. Pap test is a test where we collect a sample of cells from the cervix and look for any abnormalities in the cervical cells. This pap test is generally done in the post-menstrual period, that is after once the menstruation is completed. See, pap test it's a screening test. It is if it shows some abnormalities, then the second step is we advise them, in case only the pap test is done, we advise them HPV DNA testing. Okay, the HPV DNA testing shows it is positive. If it is positive for HPV virus, then we recommend the next step is colposcopy. That is another, it's a kind of microscope where we, with the help of which we try to see magnify the cervix and take a biopsy in case needed. So the rest of the treatment depends upon the biopsy report. HPV is the short form for human papilloma virus. It is the vaccine for this viral infection. HPV vaccine is the vaccine for cervical cancer prevention, and there are two types of vaccine available. The Gardasil 9 is the most commonly used since it covers 9 types of HPV virus. HPV vaccine is recommended between 13 to 26 years of age as per the DOH guidelines in UAE. The two doses are given between 13 to 15 years, that is the STAT dose, and after 6 months the second dose is given. And between 15 to 26 years, 3 doses are given, that is the STAT dose and the second dose after 1 or 2 months of the first dose, and the third dose after 6 months after the first dose. The HPV vaccine can provide protection against vulval cancer, vaginal cancer, the genital warts and the anal cancer, and the oropharyngeal cancer, that is the cancer for the back of the throat, and head and neck cancers. And this it can be given in men also, since it provides protection against the anal cancer as well as these genital warts and the cancer of the penis also. Take home message is the cervical cancer is the cancer where we know the causative factor, and it can be detected and treated. Second thing, if you are the parent of a adolescent girl, please do the HPV vaccination as per the guidelines. And the third thing is regular screening for pap smear could be done if you are a woman in the reproductive age group. Hope I was able to answer your queries or doubts regarding the cervical cancer. If you want to know more or consult with me, I am Dr. Ramesh Kumar, working at NMC Medical Center, Shahba, Sharjah.